Acupuncture, a system of integrative medicine that involves the insertion of needles into specific points on the body to elicit a powerful healing response through neurohormonal pathways. Acupuncture is my life. Let us begin. Hello everyone, and welcome back to my show. I'm Dr. Lott, your host and educator from Acupuncture is My Life. And I'm back for part 2 with Dr. Ada Sandoval to discuss acupuncture and psychotherapy. Dr. Ada, how are you?
I'm doing well. Thank you very much for inviting me to the show again.
Oh, gosh, my audience loved part 1. And I'm here to get into part 2 to discuss a little more in depth regarding depression, anxiety, and stress. Now, depression, anxiety, and stress are really becoming epidemic in nature individually throughout the Western society. And there are medications that help people, and there's also counseling that helps, and acupuncture helps as well. And here, I work together a lot with Dr. Ada Sandoval in dealing with those 3 areas. And today we're going to talk a little more in depth about how we approach it. Now, Dr. Ada, when it comes to depression, what's your general approach in treating patients?
I think that one of the things that I like the most about informing the public about depression is to recognize the symptoms. Individuals may go throughout their daily lives feeling blues,
Right.
and that's okay because feelings are feelings and they come and go. You don't always feel the same way. But when it comes to clinical depression, it means that the person has severe symptoms such as isolation, not wanting to talk to anyone, keeping themselves in the house, not enjoying recreational activities, and sometimes even they start having suicidal ideation, and that becomes clinical depression, and that's when they need to reach a professional regarding how to recognize the symptom, how to manage the symptoms, and to see the outcome of that management of the symptomatology.
That's very interesting. Because also getting to the point of clinical depression, the mind can create astounding imbalances in the body, and it's my job to recognize, to diagnose that, and to reset or rebalance the body. And later on in the show, I'll go into detail as to points that I use to deal with depression in and of itself. Now, when it comes to anxiety, what's your general approach to treating or dealing with patients with anxiety issues?
Anxiety, again, recognition of the symptoms, because one of the things that happens in terms of experiencing anxiety is that our theoretical approach could be an array of different perspectives, but it has to do with unresolved family conflicts that you may have originated from day one of your life, and then the attachment that you have with the social environment, with your parents, with your people around you, with the person who is a caretaker, who is a significant person that you make a connection and a healthy connection with. And if you do not have that, they will replay later in life, coming up as anxiety symptoms. So one of the things that I like to do is for individuals to connect with the professional of their choice. In this case, if I'm talking about my patients, it has to do all based on the relationship, how you connect with that person, and how in a healthy way that person will utilize what you learned in the session outside the session, in terms of controlling their anxiety, recognizing, first understanding, and then accepting what's happening.
Wow, that's interesting. And I like how you spoke about like the environment in which they're in can sort of like trigger, from past experiences and cause anxiety, and there are also acupuncture points for that. Medication is great as well, but sometimes they may need therapy or acupuncture to accompany whatever medication they may be on. Now, the third area that's of interest, especially to my audience, is dealing with stress. Because in today's general societies, I won't say east, west, whatever, globally, but stress is at an all-time high. Now, how do you approach dealing with patients who are inundated or overwhelmed with great deals of stress?
I think it's important that you mention the environment because it has a lot to do with how you manage stress. It all depends on the social context in which you are, and you mentioned the Western social environment. The social environment in mainstream North America is too demanding. It's an individualistic society, and it demands a lot of the individual. So you are prompt to try to reach goals that you have to complete objectives to get to that goal. And some people do not have the tools to attain those goals. So what happens is that it becomes an attainable goal for the ego, and you experience stress because it's a response. It's a response to an external stimuli that is happening, and you cannot handle it. So therefore, the person starts to feel stressed physiologically and stressed psychologically, because you may feel headaches, you may feel constipation, you may feel other physical symptoms that are actually responses to the stress that you are responding to the social environment. And I'll give you an analogy. If we were in a different social context, maybe in the Caribbean islands or South America, we will probably not be responding in the same way because it's a different demand, it's a different social context.
Wow, that's interesting. Just to add to that is because stress triggers the sympathetic side of the nervous system, and it puts us in a state of fight or flight. And with that, you get constipation and so forth and so on. And there are acupuncture points that are great for that, especially in the ear. There's a sympathetic point in the ear that really calms people and puts them back into a parasympathetic state. But I want to talk about acupuncture and certain points that are basic, which I've had great success with when it comes to dealing with patients who experience depression, anxiety, and stress. A favorite among many of my patients is yin tong. This point corresponds to an area ascribed to the third eye by many traditional cultures. This point is very effective when it comes to treating anxiety and agitation. In follow-up treatments, patients tend to ask for this point the moment they walk into the treatment room. Another great point is called Bai Hui, which is located at the top of the head. Now, this point is great for treating the brain, heart, and spirit. Heat and oppression of the heart, fright, palpitations, disorientation, sadness, and crying. Now, there are 2 points on the liver channel that are great for treating stress and agitation. The first one is Shengjiang, liver 2, which is located on the dorsum of the foot between the first and second toes. This point has the ability to clear liver fire, which sends a lot of heat rushing upwards to the head. Now, most times when a patient is dealing with severe stress and agitation, I would accompany liver 2 with Tai Chong, liver 3. It sort of enhances the clearing effect of liver fire. And another great point, which is located on the heart channel, is Shin Men Heart 7. This point has a great calming effect on Shin disorders. I tend to accompany Shin Men with another point, which can sometimes be painful upon insertion because it elicits a heavy chi response, although very, very effective in regulating the heart and calming the Shin. This point also treats insomnia and poor memory as well. And that point is Neiguan PC6, which is located on the pericardium channel. Now, these are some of the more basic points in which I tend to use when treating patients when dealing with depression, stress, and anxiety. Of course, a full diagnosis is done to determine if there are any underlying imbalance in a particular meridian. Okay, everyone. Thank you for joining both Dr. Ada and myself for another episode of Acupuncture and Psychotherapy. And Dr. Ada, I want to say thank you for coming on my show again.
Thank you very much, and good luck to you for the whole entire week.
And once again, don't forget to subscribe to my channel. And until next time, acupuncture is my life. What's yours?